And welcome back to another episode of Let's Talk 30. This week, we are doing part 2 of Your Mental Health Matters, and we are joined by Dr. Keo Forde. And I'm just going to introduce her very briefly. And she is a product of the University of the West Indies, having studied at both the Mona and Cave campuses. From UWI, she has attained Bachelor's of Medical Sciences, Bachelor of Medicine, Bachelor of Surgery, and Doctor of Medicine in Psychiatry. She is currently a senior registrar at the Psychiatric Hospital who has a passion for mental health promotion. Dr. Forde is married with one daughter. Welcome.
Smart.
Welcome. Thanks for coming.
Yes, welcome.
It's my pleasure.
Yes. So we're going to get right into it. Basically, we just want you to tell us what are some of the most prevalent mental health issues affecting persons in our age group, I would say between 25 and 40. And then you could probably just give us a brief explanation of what they are.
Okay. So in Barbados particularly, I would say in our age group, the most common ones would be like depression, anxiety, and then substance use disorders. So whether that is marijuana, cigarettes, so nicotine, cannabis, alcohol, any of those. I would say that those are like the most prevalent ones in our age group that you would normally see persons coming to us for. So when people say, okay, when they hear anxiety, they just think, oh, okay, a little nerves, you get anxious, okay.
Yeah.
But there is a certain level of anxiousness or nervousness that is normal for everybody,
Right.
depending on the situation. You have to speak publicly, you have to do an interview. Yes, you get anxious, you get nervous. That's normal. The problem comes when, as I tell persons for all mental health disorders, is when it starts to affect your functioning. So when it gets to the point where you being anxious, you feeling your heart is racing, you sweating, your stomach upset, all the tension in your neck, your back, your hands, all your muscles, and you having a headache and you can't think clearly, and this is affecting you in terms of work, even at home, that sort of thing, then you start to actually worry about everything. While everybody may not have all of those symptoms, when you start to realize that it's severe enough, then that would be considered, because there's a spectrum of anxiety disorders. So you have like generalized anxiety disorder, which would be kind of what I was describing in terms of worrying about everything, having difficulty sleeping, difficulty concentrating, and feeling very nervous, and all these symptoms that I was speaking about in terms of the heart racing and stuff. And then there's stuff like, previously, because we have a manual of a diagnostic manual that we use, things like post-traumatic stress disorder would have fallen under that, but now they've taken it out of anxiety and put it in its own category. But to be honest, a lot of symptoms are kind of similar, so not sure the reasoning for that, but we have to follow what they say. And then there's like social anxiety, because there are persons who have these symptoms when they're in social situations, when they have to go in public and that sort of thing, and be in crowds and and stuff like that. So those ones would be the anxiety disorders. And then like phobias and stuff falls kind of in that category as well. So when people say, okay, I am afraid of clowns, like people laugh at it, but like you don't really understand how that person's feeling
on the inside,
when they see a clown. Like, and a lot of the times it happened, when they were younger, they didn't have a good experience with it, and to this day as an adult, they don't bring no clown to the child party, because I can run for the hills. And there are people who are afraid of balloons. The most common ones would be phobias of like needles and blood and that sort of thing. Those are the most common ones, as we all know, because I tell persons, I think my first experience was when I was a student in Jamaica, and I was at the hospital downtown. So I mean, like real bad men coming in there, and them coming in after them get stabbed and shoot and all sorts of things, and I trying to pump an IV on you, and oh my god,
Wow.
just hold on. And then,
But you just
you
got
just
shot.
get stabbed. Like, we mean? But it's a real thing.
Yeah.
And so then, of course, a lot of people, depression, no, everybody, you're accustomed to people saying, oh, I feel depressed.
Yeah.
But I tell people it's a lot more than just the mood. Like depression, yes, you may feel sad or down right now, but tomorrow you might not necessarily feel that way.
Right.
But for depression, this is a sustained feeling for the majority of the day. So it's either, for the criteria, you either have to feel down, depressed, or sad for the entire day, or you have a loss of interest in the activities that you would have once enjoyed. So you have guys who used to play, let's say you used to play football every evening with the fellas, and then now you don't even want to see football on TV.
Yeah.
You're not interested in doing anything like that. You used to like reading, you used to like dancing, and you don't want to do any of those things anymore. You don't find any pleasure in doing it. And in addition to those, then the other symptoms in the criteria would be difficulty concentrating, a change in your appetite, so whether that is more or less, and with that would come weight gain or loss. And I mean, it's unintentional weight loss, not like, or unintentional weight gain, but not like, I mean, we all know during the pandemic that we was eating the whole creamery ice cream, so we're not gonna like say we don't know where the 10 pounds come from, because we know where it come from. But this person, these people really just can't control it. They're not able to, their appetite has changed. So it's either that they're eating less or eating more, they're sleeping less or more, or having difficulty falling asleep or difficulty staying asleep, because there are different types of insomnia,
Yeah.
And then the one that everybody obviously worries about, which is suicidal ideations. And there's a spectrum where that's concerned as well, because I tell persons, yes, you have thoughts of, some persons may have thoughts where they actually say, I want to hang myself. But there are persons who just say, I wish I just don't wake up tomorrow. Or I wish I could walk in the sea and don't come back. And I wish I could get away from all of this. Yeah. So they want to die their death wishes, but they don't actively want to kill themselves. Right. Yeah. And people don't think about that as suicidal as well, right? But those are all on the spectrum of suicidal ideations. And then sometimes persons with depression actually physically start to move slower. Like you would say, but her body, he's very sluggish. Why she picking up? She got a pep and she stepped no more. Why she not hurry up and come along? But they literally are moving slower, and they may not even realize it, but other persons will realize, but she real slow. What going on? I had mentioned the difficulty concentrating as well. So like you have persons who can't even watch the whole of the news. They can't read an entire article because you can't focus.
Okay. Right.
And then when you get to substance use disorders, the thing about it, what makes it difficult in Barbados obviously is the culture. So we are the home and birthplace of rum. And there are as many churches as there are rum shops in Barbados, and we all know this. I mean, I don't be ashamed to tell people, my uncles and them used to got me in the shop all the time. And I come from a family of addicts in terms of alcohol on both sides. Hold on, they're not shocked when they see this, but that's the truth. And so drinking is normal in Barbados.
Yeah, it is.
You know, being wasted is like a rite of passage. But is again, yes, binge drinking is a problem. But again, as I said, is when these things start to affect your functioning is when we have a problem. Obviously, we generally don't want you to use alcohol. You know, I mean, an occasional drink is fine.
Yeah.
But drinking the entire bottle of wine every day is a problem.
Right.
The day that you drink a bottle of wine and you're not gonna drink another one until like next month or next 2 months, that's okay. I ain't gonna judge you. You're going through something. Just drink the wine. But when you're doing it on a daily basis and you are neglecting your obligations, so is affecting your coming. Because what happens a lot of the time, you start to realize people they start to come late to work because they can't get it. They will just not be producing as much as they should, so they're not handing in their stuff by the deadlines. You're supposed to pick up the child and you don't even think about, oh shoot, at 5 o'clock on you even think twice about the fact that you actually supposed to be picking up your child and you in the shop drinking with your friends. And then they get very defensive when persons speak to them about they're realizing that their use of the substance is increasing. So whether that is cigarettes or marijuana or alcohol or prescription medication, painkillers, anything like that, they usually get very defensive about it. They start to use more and more of it because you don't get the same high from the same amount. So you might start off smoking 2 spliffs and feeling good, and then you realize you have to be smoking 20 spliffs in a day in order to feel the way.
Yeah.
And of course, with increased use, there's more effect. It more affects your functioning at that point. So those are just a brief overview of the more common ones. Because I mean, people, everybody hears schizophrenia and bipolar, but those are a whole nother discussion. And I wouldn't say that they're necessarily the most common ones in our age group.
Right. I actually didn't even think of substance abuse being in the category of.
But it's now that you've said it, it makes a lot of sense.
Yeah.
Because even when something is wrong, so if you even try to express yourself to somebody, because this happens to me often. Oh, you need a drink. Let me go for, I don't need a drink.
No.
The drink it made me feel better at the time. So when I wake up the next day, I can still be going through.
Exactly.
And I got this bad habit of when I started to feel anxious and my head, a lot of those symptoms that call, I deal with. And I have a bottle of paracetamol now next to my bed. And I just be like, oh, another headache, 2 more paracetamol.
Right.
To the point, I was telling somebody the other day, I need to stop taking these tablets like this. And I don't know if, I don't want to say it's because of COVID, but COVID definitely made a lot of things worse. But
everything.
It's getting to the point now where it's what else can I do? Because actually taking this medication, and I would never think of it as substance abuse. It's paracetamol harmless. My head hurt me to me paracetamol. Which is ignorant.
A lot of people think of it that way, Well, the other thing is that I will caution you that taking the paracetamol for the headache over and over actually causes more headaches.
Well,
after a while.
Probably why I'm
So that's just an aside for everybody. The more painkillers you take, the worse the headache actually gets. So you try not to take it unless you have to. Yeah.
So for these conditions that you just went through, is there a middle ground in terms of dealing with it? Because I am not the therapy person. I mean, it crossed my mind a couple of times. Should I talk to somebody or just, try to fight through, life goes on, whatever. I just can't see myself coming to tell a therapist. I can't do it. I can't even do that with people that I friends with. So
maybe, funny enough, you might actually do better speaking to somebody who doesn't know you. And I will tell persons you can get through a depressive episode without medication, without counseling. But it's going to take you a year. As opposed to if you actually go to someone and because I tell persons there's no harm in getting the assessment because it doesn't mean that you're going to be on medication.
Right.
It doesn't mean that because there are some persons who come and they're I just don't feel like myself. And when they come and you do the assessment, you're okay, well, you don't actually meet the criteria for depression. You don't meet the criteria for anxiety, but it's clear that you're going through something. So you may just be having difficulty adjusting right now because that's another thing. Adjustment disorder. I guess our diagnosing of adjustment disorder has increased during this period. I don't even want to call the word. This period of time. So adjustment disorder is when there's a identifiable cause, but you don't necessarily meet the criteria for depression or meet the criteria for anxiety. But so it's a stressful period in your life. Okay, you lost your job or a breakup or the death. Well, all right, let me not get into grieving. That's a different topic. So then we diagnose you with adjustment disorder. And that doesn't necessarily mean that you have to be on medication. You might very well just need therapy. And I tell people to not be afraid of therapy, honestly, and there's levels to this. I tell people everything for us is on a spectrum. So you can start with I tell people for sure you need to have a trusted friend or loved one, somebody that you can vent to, even if that is all you're doing.
Yeah.
And somebody you go to when you don't feel good, right? And then you could, if depending on your religious persuasion, religious leaders, some, not all, are very good at counseling. And the good ones also know when problems are beyond them.
Right.
And then you can, there's life coaches. Well, that's a in vogue topic as far as I'm concerned now. But there's life coaches, there are mentors, there are counselors, and then there are psychologists. And then there's, when you get to, you need these psychiatrists.
Right.
Can you just tell us the difference between a psychologist and a psychiatrist?
For sure. And I feel like I've been doing this for the whole of this since last year. And it's a common thing because a lot of people don't understand. So let's take, it's easier for me to explain what I do so that you can understand the difference. So I'm a medical doctor as a psychiatrist. I can treat everything from urinary tract infection to pneumonia, but I chose to specialize in mental health disorders. I tell people, to be honest, I really didn't enjoy anything else except maybe pediatrics. Despite being a mother, I do not like dealing with parents that much. So I realized that was not for me. Exactly. That was not for me. And I liked obstetrics. Again, vaginas are not for me. So I really enjoyed psychiatry. And honestly, I enjoy my job. Like, there's never a day that is the same, right? And I mean that in a very good way, not even weird. Like, so I specialize in mental health disorders, but we still, at psychiatric hospital, all the doctors still have to treat everything because we have persons who were actually chronic patients and residents at the psychiatric hospital, unfortunately. And so I can prescribe medication. Part of my job when you come to me is to do the assessment and to determine whether what is going on with you is due to a mental cause or a physical cause. So is it that you had a stroke and then really a minor stroke and didn't really realize, and that is why you're now having these thoughts, and that's why this person's behaving that way?
Is that common?
Yes.
The young people?
Well, not common in young people, but can happen. We've had young persons who've actually presented, with changes in their behavior and all sorts of stuff, and then when we say, this isn't quite fit what I expect to see. And when we do investigations, so we will do blood investigations, radiological investigations, so we'll send you for a CT of your brain, especially for somebody who's now coming for the first time. And sometimes, they may have a brain tumor, and that's what causes.
I was thinking, where I learned that? Grace.
Grace?
This lady was acting strangely. I know that's always in my head, and I know somebody that happened to this year.
We've had people.
She was seeing snakes and stuff in her head. Her husband wasn't sure what was wrong, and they took her to the doctor and found out she had a tumor.
Exactly.
Yeah.
So our job is to decide, to investigate and figure out, is this purely a mental health issue or is this a physical issue? Is it because your thyroid is out of whack when we do the blood test? Is it because you have your sodium or your potassium or something is off? So that's what we are. It's medicine,
Right.
and we do some form of psychotherapy just because resources are limited in Barbados. So in terms of the talk therapy. But, our job is mostly the medication and stuff.
When you say psychotherapy, I just want the listeners to understand everything.
Yeah. So the psychologists mostly do psychotherapy. So psychotherapy involves what you would normally think about when you think about a shrink or counselor that you see on TV laying down on the couch, which they really don't do anymore. It's mostly sitting. You might be sitting on a couch still, but not usually. Right? Psychologists would usually have done, in Barbados, to practice as a psychologist, you would have done your bachelor's in psychology, but also you would have to do a master's in clinical psychology or counseling psychology. And then you can go as far as to do your PhD. So they may very well have the title of doctor as well, but in Barbados, they can't prescribe medication. There are parts of the US where they have PhD psychologists have limited prescription abilities. That's not the word I wanted, but they can do that to a certain extent for certain things. But they mostly do talk therapy, which is the psychotherapy. So it's helping you develop coping mechanisms, helping you to change the way you think in terms of automatic negative thoughts and that sort of thing when it comes to depression and anxiety, or to change the way you react and behave in a situation. So they help you just to get your life in order and change it a little bit, change the way you think, change the way you act. And so that's what these psychologists does. But we all work as a team. Because like, as I tell people, psychiatric hospital for sure. And even there's a psychiatric department at QEH, which some people didn't know as well. Because that's the one thing I realized since last year is that a lot of persons don't actually know how to access mental health services in Barbados. But we could talk about that.
Well, I actually want to piggyback off of what you and Latoya were saying, but in two parts. She mentioned that, like, sometimes she would talk to somebody and they said, you need a drink, let's go and have a drink. So I had a friend that had very bad anxiety. And what I realized is my responses used to trigger them. So where I thought I was being kind, it was like, no, that's not helping. So I wanted to find out from you, because I might be somebody that might tell Latoya, oh, let's have a drink. That obviously is not working for her. So my question really is, how do I assist her as a friend?
Okay. I tell people you have to meet your friend or relative where they're at. Right? So it's what do they need from you? So initially, because obviously there are different scenarios, but sometimes they may just need you to listen. And I tell a person that is one of the biggest things most of the time. It's literally to listen. If they ask for your opinion, you can give it, but respectfully understand that they don't have to take the advice.
Okay.
But you can give your opinion. Just don't expect that the person is going to change whatever to your liking just like that. And be non-judgmental. So you have to let them know and do it and mean it. That whatever they say, you're not judging them. I am here to listen to you. Sometimes they may not even need to listen. It's just to show up and be present when they need you. And sometimes it may be to just sit down and watch something on Netflix together and you don't talk, you don't anything, just sit there. It may be to hold their hand and encourage them to go to speak to a professional, and it may be you going with them to the first couple sessions till they're comfortable. It may be doing the yoga class with them or a yoga video on YouTube or something to help them cope, and exercise is always good. So you have to meet them where they're at. You can't force them. You can't force them to go or do anything.
So my question for a little bit more, if, you talk to them on the phone and say, I'm feeling anxious today, and they don't say anything else, do I ask them, what can I do to help?
Definitely.
Or, okay, so just don't say I'm feeling anxious today and just say, okay, you'll get better. Don't do that. Just say, anything.
The worst thing that you could do.
Okay.
The worst thing you can do is to say, you can be all right. Like, we do that all the time.
Like that's that we say all the time.
It's a cultural thing. And so it deter you from even bringing it up sometimes. Because even what you just said about other things people can do, I can be very honest. Like, there was a Sunday, it was just like, my head was all over the place. And I asked my partner for a hug. And he had just come from the gym and he was like, hey, sweaty. And I burst into tears. And he was so confused, like, what?
Like, I know that's
what
you
like, you just can't hug me?
Yeah.
Like,
yeah.
And he couldn't, came in the bedroom after, like, I'm sorry, I didn't mean anything by it. I just didn't understand, like, how important it was for you to get a hug in this moment. So,
I'm glad that he came after and said something.
I think he was so confused.
Exactly. Because a lot of people don't know how to react. They're like, okay.
And if I could just add the challenge, because we always have this conversation. I mean, not necessarily in relation to mental health. like the older generation, like when we try to even just say to your parents, like I think parents feel like because we're children we don't have problems.
No,
like,
you don't.
even though we're 30 something,
But
it's
we're
like
still children.
well, yeah, like you take the time my father like anxious.
What you
He'll
got?
be like,
What
"Stop
you
That's what I'm
got to be
saying.
anxious about? What you
What
got
do
to
you
be
work?
depressed
I
about?
can't wait till you got the things that I to deal with. Things I
Actual
even
worries,
like to
yeah.
say that.
Yeah, you ain't got a problem. You don't see problems yet.
Yeah.
Yeah. So I
That
just
is so true.
Yeah.
how would you or what would you say to us when we're trying, to communicate to the older generation, like what we're going through, because they are the most dismissive ones.
They are. I mean, not all, but
Yeah.
most of them are, because they have been taught and it's ingrained in them to just man up or woman up and push through.
Pushing.
Yeah.
And they expect everybody to do that, and they feel like generations after them are just weak because we're in touch with our feelings. And I'm like, you know what, I just cannot deal with that today. And you just have to, I tell people, you express, especially as an adult, you express to your relatives and the older generation how you are feeling. That is your business. If you do, that is their business. If they do not want to understand, I will explain it to you again. I will bring a friend to explain it to you. I will let my doctor explain it to you. I will give you a pamphlet. But if after all of that, you still not getting it, that's where I just gotta draw the line, and we gotta create boundaries, because you are bringing me down. You don't understand. I will love you from afar. And when I'm in a better space, we could continue. But you just need to understand.
Yeah.
It's very
Top
major.
tier.
Yeah.
It is the key to survival.
Yes.
Yes.
Wow.
It is the key. And I tell people, don't use it as an excuse to be unmanly and antisocial. That's not what I'm telling you. But people have to respect your wishes and the way you live your life. So it's like, okay, I respect you. I love you. Because, I mean, like, we all have those family members. I respect you. I love you. But I don't need to be around you all the time. And no, do not tell me what to do, my child. No. You do not get to have a say in my career choice. And if I decide that I decide that I do not want to be a teacher anymore and I want to go and be an artist, you are supposed to support me. You are not supposed to be like, well, you went to school 9 years to go and do that for.
Yeah.
That makes it worse,
Yes.
And that is what would cause even depression and anxiety in some people.
It's very
And
true.
people don't realize that. I mean, you're free to have your opinion, but then to do it to a point where, like,
The drill it in.
you're an idiot. What are you doing?
Drill it in.
Yeah.
And I'm like, it's just awful. Honestly, it is very eye-opening how the lack of support that a lot of people have, and they are in very toxic families. It's amazing.
And culturally, as you said, that's just how it is. And, that's why I'm big on educating people and
too.
finding out ways that people can just understand. That's why I can be vocal with we live together, so I had no choice but to tell him certain things.
Correct.
I can talk to my mother. But, you can only try. And people like you and Rashid who are using their platforms to educate people, I just hope you can continue to do that, because we need to change the trajectory of how we discuss and deal with mental health in Barbados.
Yeah.
That is one of my pet peeves.
I tell people there is no health without mental health.
Yeah.
I am sorry. The head and the body go together, and it goes the other way. If you do not take care of your body and your physical health, it will affect your mental health as well. And you need to be whole. You are a whole person. You want to be whole, a whole,
Exactly.
healthy person.
Yeah.
I think we need 3-day work week. No, I honestly, I was thinking,
agree with you.
they work in 5 and 6 days. That's not good for your mental and
I
physical
could draw
health.
the line at 4.
Yeah.
I tell
I
people
hope the world,
honestly.
I hope
We
the
need
world goes
3-day
in that
weekends.
direction. Yeah. No, seriously.
Yeah, because you could,
Because by
you
the
could
time
push.
Sahara, you do your chores and whatever,
Exactly.
run around,
No, that
do
ain't
the
your
things.
things. And you got a real
And
responsibility.
then Sunday, you're doing
Preparing for Monday.
For Monday.
For Monday.
That's what
Like,
Exactly.
you have
And
literal one day.
then when you
And
got
we
your little
still-
side hustle and all kind of thing, like, it's just
Correct.
Lord.
I agree with you. 4 days. I like 4 days. You can push. I could push. I could give you my all for 4 days.
Yeah.
knowing that I'm gonna have 3 days to
it's
do what I need to do.
Nobody don't really do no work from Friday anyway. I say that like Friday's the least productive work day, so whatever
is
we
just-
here.
yeah.
Like, I mean, it's just
Obviously, we are still in a panorama.
and Ashurama, don't forget. The volcano's still active.
Yeah, we got all sorts of ramas going on. So obviously, some of us have been going back to work. We're transitioning to going back to the office and that type of stuff. So my last question would be, how would you like to tell the viewers they can manage like stress and anxiety post? Well, I can't even say post COVID because we still in it.
No, it's not going anywhere. So the first thing I always tell persons is control what you can control and just accept that there are things you cannot control. And that makes a humongous difference because we cannot control how long this is going to last. We can't control other person's behaviors. We can't control the economy. We can't control a lot of things. What you can control is protecting yourself and your environment and your family. So you follow the protocols and you wear the masks, you physically distance, not socially, physically distance as much as possible. You rest when you need to rest. You only leave home when you need to leave home. If you choose to leave home, those are the things. Protect yourself and your family. When you do that, it makes a huge difference. It don't make sense worrying about everybody else because you can't make everybody else behave. You can't. Yeah. I just went to Florida and you definitely can't make everybody behave. I did. You really cannot make everybody else behave. We know that them is lose their minds out there. Yep. The other things are eating a healthy diet. It is very important. There's no specific diet for mental health. It's just eating a healthy, balanced diet. Exercise, whatever form that is for you. It may be just turning on your favorite playlist and dancing hard for half hour. Have your own stand home party. Have a trusted friend or relative, partner, somebody. Have your person that you can go to when you are feeling that you're in difficult times. One of my biggest ones is to take breaks from social media. Because I love social media. I tell persons that. I love it. I use it for the tool that it should be. But there are days when it is too much. And my phone stays turned down like that. And if you want me, you call me. If not, well, you obviously didn't want me bad enough.
She is a big believer in this. She is.
Yes.
She is.
So you take breaks from social media because I tell people, remember, people only show you what they want to show you. So you sitting down there saying, oh my gosh, I am 35 and I am married and I got no children. And look, she got a husband, she got 2 children, them just build a house, them just buy a new car and whatever. And their fridge is empty.
Yeah.
Like their fridge is empty. They do not even speak. They sleep in separate bedrooms. You don't know.
You don't know.
So,
take a break from social media. Follow trusted news sources and do not overwhelm yourself with news about COVID and the ash and this and the previous U.S. president and all that. You know, you just gotta tell yourself, all right, I'm going to take a break and seek help when you feel like you really need it, and don't be afraid to seek help. Those are my biggest takeaways. I could tell you a lot of other things, but those are the things that I think are really, really important for our age group particularly. And take a break when you need it. Rest when you need to rest. Do not be afraid to take a mental health day. You have sick days for a reason. I'm not telling you to just go and get 2 weeks sick leave because you want to go and frolic. I'm telling you, but if laying down on the beach is going to help you recharge and bring you back to being more productive at work and in a better mental health space, I got you.
In my previous job, we actually used to take mental health days all the time. We just used to call
it in
as a sick day.
need.
That was the code among us. Like, I need a mental health day. I'm not coming here tomorrow. Like, you would send it in as a sick day, and then correct
But I
on
think
the form,
that employers really should
right, because if I had put I needed
mental health
a break, my boss would be like,
what break you can need?
Aren't you physically sick? You better come to work. So, and that is a problem.
That's a whole nother culture that we got to change. Whole
in
nother
the
discussion.
Maybe in the world.
Yes, that is a whole nother discussion.
Yep.
But take mental health days.
The doctor says so.
Take them. We take them. I encourage you to take them.
This was very informative.
It was.
Absolutely.
I really enjoyed this discussion.
You gotta come back. Oh my goodness.
That's easy. As you said, I love mental health promotion. So anything that I can do to get the word out there, because I tell people again, I'm not getting any money from this. I work for the government, but it is my passion. So
Yeah.
Can you share like your IG handle? I think you have a page.
I
which
do.
is dedicated
Dr. Keo Psych. So that's DrKeopsych. Because my other one is my personal page. If you're my friend, it's not a problem.
Personal page. Follow the business page.
Also, there is the Barbados Association of Psychiatrists. We relaunched this year as well. So you can follow us on Instagram and Facebook. That's barbados.assoc. So that's ASSOC.psychiatrist. That's Instagram.
Right now.
And then the Barbados Society of Psychologists. I might have it wrong, but their page is also very, very active, and their Facebook page actually has a list of like all of their members and what their specialties in terms of children, trauma, all of that.
Yeah.
And their contact numbers, their qualifications, everything. So their Facebook page is very, very nice.
That's useful information because you just don't know where to look.
Exactly.
She said earlier that you don't have access to these things.
Yep.
Well, thank you very much for joining us. The conversation was definitely insightful, and I hope that the viewers learned something and that we all walk away better able to cope and help our friends cope with these challenges. Good. So thank you.
Thank you.
It was really nice being here.
Oh, wait, we got to close.
Yes, Letitia.
That's why
I'm like, it was so good that I forgot that we had to close. But anyway, so thank you for taking the time to listen to another episode of Let's Talk 30. We hope you enjoyed the discussion. You can find us on all of the podcast platforms. We have Spotify, Apple, YouTube, and you can follow us on IG at Let's Talk 30.bb. Always remember, life is too short to live counting the years. So if you're on your journey to or through 30, enjoy the ride.